Welcome to The Explainer. Today, we're going to break down Dr. Omar Danoun's expert approach to managing epilepsy. We're going to turn what can feel like a really complex journey into a clear, understandable path.
Getting a diagnosis like this brings up a ton of questions, and it's so easy to feel lost. But the good news is, there's a really clear framework that can help you navigate the path forward.
Dr. Danoun calls it the triangular method. It's a simple but honestly a really powerful way to understand the journey to getting seizures under control. It's all built on three essential pillars. Okay, let's dive right in. Everything, and I mean everything, starts with this first pillar, getting the diagnosis right. This isn't just some step in the process, it is the entire foundation for any effective treatment. As Dr. Danoun puts it, a correct diagnosis is a foundation that all successful treatment is built on. If you get this part wrong, everything that follows could be on pretty shaky ground. So the process kicks off with seeing a specialist, an epileptologist, if you can. Then it's all about sharing the details of what happens during an event, and that's followed by a really thorough physical exam. And here's a huge tip. If it's at all possible, have someone record a video of a seizure. Dr. Danoun says a picture is worth 1,000 words, right? Well, a video is worth more than 10,000. It gives invaluable information that just telling the story can't quite capture. Okay, so let's move on to the second pillar, which builds directly on that diagnosis. It's all about using precise testing to get a really clear picture of what's happening inside the brain. So there are two fundamental tests here. You've got an MRI, which gives a picture of the physical structure of the brain. It looks for any abnormalities. And then there's an EEG, which reads the brain's electrical activity, showing exactly how and where seizures are happening. Now, this is where it gets really interesting, because the whole point of this testing is to figure out if we're dealing with focal or generalized epilepsy. And this is absolutely vital because some medicines that are designed for focal epilepsy can actually make generalized epilepsy worse, so you got to get it right. All right, so with a firm diagnosis and clear test results in hand, we can finally get to the third and final pillar, creating a treatment strategy that is built not just for the condition, but for the individual person. And this is a key point Dr. Danoun really emphasizes. Treatment is so personal. There is no one-size-fits-all approach. Your unique circumstances are what guide every single decision. So there are three key questions that guide the treatment plan. It all starts with the most fundamental one. Which medicine is the right one for you? And this slide just illustrates perfectly how that choice is made. It really depends on your entire health profile, from whether you're planning a pregnancy to coexisting conditions like anxiety to any other medications you might be taking. So once the right medicine is chosen, the next question is all about the dosage. And the goal here is very, very clear. The dose has to be high enough to achieve what's called seizure freedom. Taking too little is just ineffective. And according to Dr. Danoun, it's a really common issue he sees in patients who aren't getting the results they need. And finally, you need to understand the duration of your treatment. Is this a short-term fix, or are we talking about a long-term plan? For epilepsy that starts after childhood, the treatment is typically a long-term commitment, often lifelong, to keep those seizures at bay. So when you put all three of these pillars together, you really start to see the bigger picture. This isn't just about managing seizures day to day, it's about approaching epilepsy as a lifelong journey. What that means is the triangular method gives you a complete, logical strategy. It takes you from that initial uncertainty of a diagnosis all the way to a clear, personalized, and effective management plan. So the crucial point is this. Kind of like diabetes or hypertension, epilepsy is a manageable chronic condition. And while there may not be a cure just yet, there is effective treatment that can lead to a full and complete life. This leaves us with one final, crucial question to take away from all this. Is your treatment plan just treating a condition, or is it truly built for you? Because that difference isn't just in the medicine, it's in the outcome.